So children of parents with PTSD, we've talked a little bit about it, but they often will express feelings of feeling unloved, confused, scared, and lonely. And you may see these things in their lives outside of their families. So you may see that they have more of a confused or lonely approach to the world, where they may see things like, I can't make friends, my friends don't like me. You might see them sitting by themselves because this is their internal dialogue, right? And children, especially younger children until they're in about middle school-ish, everything that happens around them means there's something going on with them, right? They point it right back at themselves. And believe that if mom or dad are upset or their teacher is, I must have done something wrong. There's something bad with me. There's something wrong with me. And children's brains are evolving so rapidly, especially during 0 to 5, as most of you I'm sure know. There's also other sensitive periods that we think are really important, somewhere around the middle school age time frame, and then again in high school. What's important about that, when there's stress, toxic stress, PTSD symptoms around them, is that their brain functionality, we believe, is actually changing. So if you're interested in brain science and kind of how kids are dealing with their toxic stress in their life, read some more about brain science and toxic stress in young children. There's some really good research out there that's really saying that this stuff is actually changing their lives for the long haul. One of the places where we have a lot of information about this is through the ACE study. Is anyone familiar with the ACEs and the adverse childhood experiences? So what we know is in the mid-90s, Kaiser Permanente did a study on adults who they were treating for obesity and diabetes. And so what they started to notice in this population of patients, that they were all reporting similar childhood experiences. And so they took that and decided to do a survey of all of their patients across Kaiser Permanente in California and ask them questions about their childhood. What they found was 20 to 40% of their clients actually had 4 or more ACE, adverse childhood experiences in their childhood. So separated from parents, parent incarcerated, drug abuse or addiction, violence in the home, sexual abuse, verbal or physical mental abuse. There's a couple other things in there. I can't get them all. And so that really, what that tells us then is it validates the idea that toxic stress is real and it impacts how we go about. Because what it said was those clients that they were working with cancer, lung cancer from smoking, diabetes, and obesity, heart disease, and there's another one, all had these 4 or more ACE categories. So what it says is if I have toxic stress, if I have these experiences as a child, my life actually might be shortened because I will end up with a cardiac problem, diabetes, overweight, those kinds of things. So it's really important that we pay attention to some of these things going on with kids, which you guys already know that. I have a hand.
There's also something out there that I want to look more into because I just stumbled across it looking at the brain and trauma and all that, but something called SPECT imaging. Apparently since years ago, someone was in that field and they were trying to learn more about the brain and stuff. And I found it on TED Talk, but they said that experiences that we have growing up, that the brain is wired differently. They were able to show it. And they said that all doctors get to use the imaging, like MRI scans and all that for heart or wherever they need, but psychiatrists are not allowed to use the technique when they could be using it on the brain, and they were showing shots of different brains and how they looked and how
Right.
it was clustered different.
Right.
Wow. And he said, if we were to coach to that, we can actually give more better treatment.
Exactly. So she's talking about some brain imaging to really look at the connection between some brain science and activity in children, and especially those who've experienced toxic stress. And there are some studies out there. One of the things, you're correct, that imaging of the brain and or mapping of the brain, which is multiple images of the brain over time, is not a payable service, not a billable service when you're talking about psychiatry diagnoses. And that's because at the moment, psychiatry and mental health diagnoses are not considered brain science issues or brain diseases in the medical billing world. We all know that may not be true. There's more research out there now showing that that may not be true. And so they are moving, there are some studies. PTSD is one of those things that they are looking at the way the amygdala actually works in the brain, along with memory. And there's 2 or 3 studies. One of them I know is with the VA at Tennessee and one of the universities there, and they are imaging military members who have had no medication for their post-traumatic stress disorder diagnosis, are within a year of their diagnosis, and they are taking a 3-year snapshot of their brain over time. It'd be a 3-year look to see what's happening with the amygdala and 2 other spots in the brain. So that just started last year, so it'll be really interesting to see what they come up with in regards to some of the brain imaging. So as you know, children can also suffer from post-traumatic stress disorder or other mental health disorders. And this is where I like to talk about the fact, actually many children don't get diagnosed with PTSD. Do you guys know why? Is that something you come across?
Oh yeah, they diagnose it with
Yeah.
chronic defiant
Yes.
conduct
Yes.
disorder, ADHD.
Yeah, so she's saying that they define it with ADHD, chronic conduct disorder, which, what is that, by the way? It's really called resilience. You just don't like how they're acting, right? So what else do they call it?
Well, no, I like the ADHD. I've seen kids over and over and over. I worked for a nonprofit dropout prevention in schools for a while, and the kid is wiggly in their seat, and they're not paying attention and they're not absorbing information,
Right.
and so they must be ADHD, and
Right.
they start throwing stimulants down
Yep.
the kid's throat, and it doesn't help. Now, if your child does not have ADHD, you're not going to see a reaction. If they do, you'll see a different child in 45 minutes an hour for the most part. But if it's not, then what else could it be? Nobody bothers to ask the child.
Right.
Hey, so what's going on at home? They're sleeping in class or they're acting up in class. We don't ask the kids. We don't think of them as human beings who also feel anxiety and depression and stress and don't have the words that we do as adults to express those. So they act out behaviorally.
Right, we see a lot of behavioral issues with kids who may actually have a constellation of post-traumatic stress disorder. So for those of you who like to get involved in research or want to look at a long-term impact in our career, you may want to look at getting involved with the DSM-6 that'll come out at some point. So in the DSM-5, there was a group of psychologists and psychiatrists who recommended, Dr. Van der Kolk was one of them, he wrote the book, The Body Keeps the Score. They recommended a diagnosis for children that covers PTSD, but that's not what they were going to call it. And it covers all of those things. It covers a child who has been diagnosed with conduct disorder, oppositional defiance disorder, ADHD, intermittent something or other, anger explosive. Yes, that's my favorite. I'm kidding, it's not actually my favorite one. Sorry, we're videotaping this. That was a joke. So they had this all together in a group, and for different reasons, the simplest way to say it is the group of people putting together DSM-5 didn't think that there was enough evidence behind the idea to have this diagnosis all rolled up into one thing. But those of us who work with children, especially children who have toxic stress, traumatic environments, sudden fearful events that have happened in their life, we know that all of that stuff is happening in a kid with those things that are happening. So it was based off the same idea, post-traumatic stress disorder, where there had to be a criterion A event. So there had to be a sudden traumatic, fearful thing that happened. And the person had to be able to kind of talk to that. So it wasn't something that was happening in utero or early on, 1, 2, 3-year-olds, but really something that the child could maybe point to. And so it had some validity to it, but it didn't move forward. So that's a realm that we need to keep working in as providers, because we see it. We know that, I'm gonna catch this thing, there we go. We know that kids have those things. They come to us with oppositional defiant disorder diagnosis, and actually I love it when those kids come across my desk, because I'm like, all right, let's figure out what this really is. I'm a researcher, I like to be involved in that realm, and if you can, if it's not a behavior that's become so ingrained, you can maybe hear what it else might be. The thing that happens, though, with kids who have some of those diagnoses, kids that Clarity works with on a regular basis, is that some of the stuff becomes so ingrained into how they get attention and how their life is now responding to them, how things are going on. Maybe there's even been something that's happened to them, and so they're kind of down this one path. And so it can be difficult to tease out that this might be about trauma, but we also know that trauma-informed care is really important. It's especially important with children who may have these ODD or conduct disorder diagnosis, or even that intermittent explosive disorder, to really look at a trauma-informed perspective or approach with them. So when we look at the family, what we might see going on, and I'm sure you guys have seen this, I talked about the isolation, the boy who couldn't go to the soccer game, and he was really feeling that isolation and acting out in class. Loud, angry responses that happened really quickly. So kids may be experiencing that from their loved one who may have PTSD, but you may also see kids do that, right? So oh, kids, it's raining, we can't go outside for play today, you know, throws a chair, stomps his feet, hits a wall. Like, those are things that that child may be seeing at home when an unexpected thing happens to that parent, or it may also be a way that they've learned to deal with their frustration, or maybe there really is PTSD in that child. Constant focus on safety. We've talked about the sleeping. So when you're talking with your parents, that's one area that I like to talk about. I like to ask them about safety. So I ask this question to both the kids and the parents, and that is, so tell me about how you ride your bike. What I'm really looking for is, are they telling me they wear a helmet? If they tell me they don't ride a bike, I'm like, all right, do you ride a scooter or a skateboard or something? What I'm looking for is, are they wearing safety gear? Are they wearing a helmet? Are they wearing knee pads? Are they wearing that, right? So the folks that may have PTSD in their life, they're wearing all of those things. And if you think I'm kidding, I talked to a family the other day. I'm new, so I haven't seen that many families here, but this family came to me to ask a specific question about something. And I was getting into the safety conversation, and I was like, so tell me about your kids when they go out, like to ride the bike or the scooter. They ride scooters. And Dad was like, oh, they're so good at this. And Mom kind of rolled her eyes, and I went, oh, I got to hear the story. So anyway, they wear the helmet, the wrist guards, the knee guard things, and they have to be covered in shirts to their wrists and pants to their ankles. I was like, oh, okay. When was the last time they went like scootering? I was thinking like when it was cold outside. He's like, oh, we do it every day. I'm like, you did that exact outfit yesterday when it was 110? He's like, yep. It's like, okay, check mark, got to follow up on that. So it comes to find out, when I was talking with Dad, he did actually. He's had 2 very serious things happen to him, and he is definitely overcompensating in the safety arena. He also will not let his kids be out of his sight if he has them by himself. They have to be within arm's length, and one of them is like 9 or 10, the other one is 5. So like, they went to the museum and they had an awful time. They all ended up kind of in a little bit of a fight down in the lobby, I guess, at the museum, because the kids wanted to kind of go and play and run around, and Dad was like, you have to be here, you have to be here. Like, he wouldn't let them go. And then at night, safety issues at night. I like to ask about that. I ask the kids, you know, so like, so tell me about your house. Like, how does your house close down at night? Like, how does the house go to sleep? And so if they tell me, well, you know, Dad puts us to sleep, or this happens, but then, you know, he goes and checks the locks a bunch. So if he's not home, I get up and check the locks. What does that mean? Tell me what that means. And so lots of times you're looking for that repetitive look at safety, or the overprotectiveness of safety. And that can really impact children. It decreases their life. It makes their experiences smaller. Like going to the museum. Has anyone been to the museum recently, the Children's Museum? It's wonderful. And it's got several broken up little areas where you could just kind of stand in the corner as the parent and let the kid go do whatever. But they're kind of far away. They're not rated arm's length, that's for sure. But it's a fairly safety setup. I kind of like it. I like safety. So, and he really talked about this being a very scary place for him, was to take his kids to the Children's Museum. We talked about unable to going to the sporting events, difficulty with young kids. So someone already mentioned this. So PTSD can really impact how that parent or that caregiver notices what the young kids are doing. So the quick movements, the loudness of young kids, and I'm talking 0 to 5, maybe 6 or 7-year-olds. But they can be really loud for no apparent reason. Like they're just decide to sing at the top of their lungs. Or they're moving really quickly, or they go from really not saying anything, kind of sitting quietly, to like jumping off of something. And so that unexpected movement for someone who has a diagnosis of PTSD can be very threatening and fearful and unexpected, which is so they shut themselves off. We'll hear about the parents or someone always staying in their man cave or the kitchen or something, and not really interacting with the family. Kids will also talk about, well, daddy's home all the time, but I don't really see him. And you kind of got to dig into that. Well, what does that mean? Well, it's because he's always sitting on the couch watching TV and doesn't talk to me. So some of that isolation with unexpectedness from the little kids can be very difficult, because now what's happening is the kids' bond or their attachment to their parents can be impacted, and attachment is a really big thing and a whole nother discussion about attachment, but you may see some of that. If you're seeing that as providers, I would really encourage that you try and talk through some strategies to have some bonding attachment times where the parent can control some of the things, right? Like maybe it's just simply sitting on your safe sofa watching a kid's TV show that you already have watched. So that worked for one of my parents, was that they would ahead of time, Netflix or something, YouTube, a children's show, watch it first and then be able to watch it with their child, because they knew what was going to happen in the kids show. The other place that can be sometimes difficult, and you may see it, video games, popular with lots of adults and kids, right? But you may hear that they talk about, daddy won't let me play my video games, or mommy stopped, interacting with me on our video game. Because if the video game updates and it does something different now, our ocular motor processes get used to the fast-paced movement of video games. And so we've seen some people with post-traumatic stress disorder really struggle when the games change. It's like there was just a big update to one of the game, Fortnite, is that it? I'm not a gamer. Fortnite, I'm looking at Michelle. Like if they just did an update maybe over the summer or something, and some of the characters change or added new characters. So anyway, one of my kids was telling me that. Maybe it was last year when it updated. Anyway, at some point it updated, and he was so upset and got in trouble at school. That's why he was back seeing me. This was about 6 months ago. And he told me that his dad starts playing Fortnite with him. And I was like, wow, what's going on? They had an update, and all of the characters kind of changed, or they were different shapes, or something happened. And now his dad, he didn't like it. He couldn't handle it. And I guess he actually even threw something across the room. So that was a place where I didn't realize that. I was like, oh, dad might be having a problem. And I didn't know that about this family. Having to have a specific seat someplace, like in a restaurant or at a sporting event or in a room like this. I'm sure you guys have experienced that before, but that is really important. And that can be difficult for kids, or kids, that's a place where kids can help. So that's the other thing about this, is it's important if the family has some toxic stress and they're experiencing some of these things and they're working with you as a provider, look for areas where the kids can be a joiner in solving some of these problems. So as a very young child, my father was a Vietnam veteran, PTSD, never diagnosed, took care of it himself, not well. I knew that if we went to a restaurant, which wasn't very often, that we had to sit where he could see the door and his back had to be against the wall. And I knew as soon as we walked into the restaurant, whether or not that restaurant was going to accommodate that for him. So, because we didn't go out very much, he only really just started going to a couple of places. Thank goodness it was pizza or Chinese, which I love both of those things. But we knew that at the beginning. Now, my dad didn't let me be a joiner in that. I didn't go pick a seat. But my young child, who's 4, he loves to pick where we sit in the restaurant. So much so that he gets mad at the hostess if we go to one of those types of restaurants. He's like, no, that's my job. So you can really have kids get involved and join in with the parents on making sure that some of these things that they need to be interactive and healthy and involved in the family, that the kids are part of too. And that's a really, really key piece if you're working with them. And then doesn't leave the house. So that's a real significant issue. If you've got parents or maybe a sibling or even the kid who really just feels like their safety is all about their house or their room, it's really going to impact someone's life.